right, so I have our patients for tomorrow, Dr. Riggs. Your 7:30 patient is Steve Smith. He was last seen back in August. He's here tomorrow for an annual, and he does need diabetic labs ordered.
Okay, I'll make sure we get those in. And he's aware to go to the lab before he comes up.
Yeah,
Okay.
his last A1C was 11.4, and back in August you put in a risk reduction consult, but it wasn't ever scheduled. So, and I was also hoping that we could put in a diabetic education consult, because he was just diagnosed with type 2 diabetes only 2 years ago.
Okay, and I notice he has not gotten metformin through the VA in about 4 months, so I'm not sure if he's getting on the outside or not, but that may explain part of the A1C problem. So
Okay.
we'll need to make sure when he comes in we go over that with him.
Okay. Your 8 o'clock patient is Eric Roberts. He was last seen back in June. He's here tomorrow for an annual, but he had his labs drawn last week. He does have a history of an elevated PSA. He did see urology once back in September and was given antibiotics for it. At that time, his PSA was 6.4. When he had his labs done last week, his PSA was up to 15.69.
Okay. Out of curiosity, have him go to the lab before he comes up. I want to do a urine and the pre-PSA.
Okay. Your 8:30 patient is Susie Carpenter. She's a new patient, new to the VA. Our clerk, Sean, contacted her yesterday and was able to obtain records from her outside physician.
Make sure I get those before end of day. I'll go through it and have her go to the lab before she comes in.
Okay.
It'll expedite things.
Okay.
All right.
And then your 10:30 patient, David Pierce, was last seen back in November. He's here tomorrow. He's complaining of worsening shortness of breath, right-sided rib pain, and a productive cough. He was diagnosed with lung cancer back in August, and his last chest x-ray and chest CT was also in August.
Okay, make sure he goes to x-ray before the appointment, and he needs to go to the lab also. Have him come in a few hours early.
Okay.
He knows he's due for it, so it's no surprise.
Okay.
All right. Good.
Your 11 o'clock patient is John Sellers. He was last seen for his annual back in September. He's coming in tomorrow because of a painful bleeding mole on his back. He also has some skin tags on his neck that he wants removed. As a side note, his brother did die from metastatic melanoma.
Okay.
And I'll go ahead and have the cryo set up in your room for the skin tag removal.
Yeah, we'll do that. We've done those before for him, but he'll probably need a plastics consult, but we'll look at everything.
Okay. Your 11:30 patient is Don Stevens. He's coming in for a blood pressure recheck. He was seen in the ER last week. You think we could put him on the nurse telephone clinic?
Yeah, do that. I know he has a cut from the VA. And let's make sure when we talk to him he's compliant with his meds, because he has not always been in the past.
Okay.
I don't want to start adjusting medication if he's not compliant.
Okay, great.
All right, I'll give him a call and get that set up and everything. Okay. The only thing I have tomorrow on the nurse clinic that I need your help on is Mr. Jack Brown is coming in for a testosterone injection, and I need a current order on that.
What's his
please.
last four?
1123.
Okay. Will do.
All right, and Mr. Gary Davis, he is coming in. It is time for his pain medication to be renewed, and it is time. But I was looking at the records, and his narcotic pain contract has expired. So I thought if you'd go ahead and put a new one in, I will have him go ahead and execute that while he's here.
Okay.
And it has been about a year since he's had a urine drug screen, so I did not know if you wanted me to send him down.
Yeah, I do. Make sure he comes up, does contract first, and then he can go to the lab, and then he'll need to come back before we dispense the medication.
Okay, I'll go ahead and give him a call and have him come in a little bit early then, since we're going to have to wait lab results. Okay, you remember Mr. Harold Buster? Well, he came in through the ER last night for a heart failure, and he's up on 3 West today. So I thought I would go up and visit him in a little while, and I just wanted to know if your schedule's free. Would you like to go up with me?
Do you know when he was last admitted?
He was last admitted, it's been about 6 months ago. And he was supposed to have a CCHT consult, but they never did see him. So I called Carrie Collier and told her he was in, and she is supposed to come over and visit him while he's inpatient and get a scale to him and everything, so we can start getting him monitored.
Do we have scales in stock, do you know? Because there was a problem a couple of weeks ago where we
Prosthetics says they have them in.
Okay,
so.
good. Just make sure he gets it before he leaves.
Okay. All right, and I'll check with you before I go up.
Okay, and make sure when he leaves, we see him within 2 weeks after being discharged. Make sure that doesn't fall
Do you want to see him, or do you want me to want him to bring him in on the nurse clinic?
No, I want to see him.
You want to see him yourself?
He's been a little unstable in the past.
Well, I'm going to call him about 2 days after he's discharged. I have him down, and then I'll call him the 7-day discharge as well, and then we'll get him on in to see you.
Good. thanks.
Okay, and tomorrow looks really good. I think the 12:30 and 1 o'clock is still available, so we should have really good access tomorrow. It'll be a
Okay,
good day.
great, thank you.
All right.